On December 7th, Mary Miller voted with the Socialist Squad to cut off funding for our heroes in uniform at a time when America's adversaries are on the march. Mary Miller can't be trusted. Fortunately, there are conservatives like Rodney Davis in Congress who support our military. Rodney Davis voted to increase the defense budget and give our troops a pay raise.
I'm Rodney Davis. I will always have the backs of our brave men and women in uniform. That's why I voted to strengthen our military, to keep America safe. I believe in peace through strength. I'm Rodney Davis. I'm running for Congress, and I approve this message.
Paid for by Rodney for Congress.
Do you want a chance to positively impact the community and grow your career? If you've got the passion, Memorial is the place. Right now, Memorial Health is hiring for a wide range of positions across multiple departments and clinic areas. Apply your passion today. Visit us online at jobs.memorial.health to see all available positions, benefits, and more. Come discover all the things Memorial has to offer. Memorial is an equal opportunity employer.
You're listening to The Morning Show on the Big 1520 across Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in this segment of the morning show, Paul Skowron, is the CEO of Warner Hospital and Health Services. Good morning, Paul. How are you, sir?
Seth. Great.
Today, my allergies are acting up. 'Tis the season, right?
I am afraid I had to take my pills this morning, too.
Yeah, I think I'm going to have to start up with the nasal spray and the pills and all that good stuff. So looking forward to it. And we'll talk about, those are some of the things we're starting to see more of in the hospital. We'll talk about that as we go along today, Paul. But the highlight of our discussion is going to be fiscal year, is it 23?
Fiscal year 23 starts May 1.
Yeah, so let's dive into fiscal year 23 budget. What are the highlights, Paul? And we'll do a deep dive from there.
I presented at the city council, the Clinton City Council, last Monday, and the budget was approved. And so we had a board meeting this last Monday, and I was able to present the fact that our budget was approved. And so it is a budget that is, in some ways, more normal. In the last 3 years, we've dealt with COVID. And this particular budget doesn't factor in any resurgence of COVID.
Mm-hmm.
But it is different in the sense that I had to factor in expenses as a result of higher wages and higher expenses and higher supply expenses from COVID.
Mm-hmm.
Yet revenue could only go up about 5% because insurance companies aren't going to give you more just because you had higher expenses from a COVID event.
Mm-hmm, mm-hmm.
So the revenue only is budgeted at about 5% higher. Expenses are budgeted overall maybe 7% to 10% higher, but the wage category is up about 14%.
Right.
And that is because while we always have had for the last few years a shortage of caregivers, a shortage of nurses and doctors. That's a long-term problem. COVID caused that to go to an F5 hurricane status for trying to find caregivers.
Right.
With the agencies attracting traveling nurses and so forth. So we had to increase wages during the last 2 years to retain the staff that we have and then to continue to try and attract new staff.
Mm-hmm.
Because COVID has gone away, that shortage hasn't gone away, but at least the severity has come down. The need for agencies is much less.
Right. So let's dive into some of those things for this morning. And you mentioned the cost of like PPE, things of that nature, COVID events and those sorts of things. Talk a little bit about the hardship perhaps that it is causing for your budget this year and how you're planning for those things.
And so I did say that this budget does not factor in another surge of COVID, and that is because we've already invested in the last 2 years in the equipment to be able to test all the testing that all the hospitals were asking initially, the government for the supplies, the PPE, and all the testing supplies. That is here now. The equipment has been invested in. The supplies are available for us and the staff doesn't have a learning curve for providing that testing service anymore. The staff is well educated if there is another variant.
Very good. So the training component of that as well. Let's dive into that a little bit. Why is training so important? What is there to be trained on during this time?
Well, just think about any lab test. When we bring in a new lab technician, even though they're going to school and so forth, they have to go through a few months of orientation for all the specific type of lab tests. And so COVID presented an opportunity for some new training and in a new variant. And it also had to be done very quickly, sometimes on the fly, when the supplies are barely getting here in time. And that's why we had COVID testing centers all over the state. But now you can see that almost all of them are shut down. The need for the testing has come down to the point where hospitals and providers can provide the testing as needed on site.
Sure. When it comes to the cost of those things, you mentioned you had to factor a lot of that into the budget. And as you were talking about that, I was wondering, wouldn't some of the federal dollars cover those things? Did it not go far enough? What's the kind of status of those things?
Federal money was very important to getting us through COVID and all of the healthcare institutions, partly because of the shortage of supplies. And we still have, in many cases, normal medical supplies, tubing and so forth, that the shipping problems, those things that had to be delivered from overseas, there's still some bottlenecks related to that. But there has been a big effort nationally amongst the government initiated and in the medical suppliers and the healthcare systems, all insisting that let's try and develop the supply chain within the United States. So that conversion is still going on, and that is successful. But there is still some categories of medical supplies that we run into surprises that they're not available when we think they should be.
Sure. Again, Paul Skowron, CEO of Warner Hospital and Health Services, our guest in studio here for this morning. We highlight the fiscal year 23 budget that was, I believe, presented to the council at the middle of May and the middle of April. Sorry. And the 1st of May, they will approve it. I believe that's going to be next week, in fact, May 2nd. So, but with this budget, Paul, just in terms of other highlights, the easing of COVID, it sounds like is really lessening the burden on the budget. What are some of the other things that are aiding in that process?
We were able to finally focus on longer term projects because of the fact that we didn't have to stress on whether or not we had enough personnel and supplies and get all that training out of the way. And the inpatient beds aren't as full as they were. The severity of COVID is so much diminished now that we were able to focus more in the budget on some longer term projects and something that really was a lesson from COVID, which is let's create an entrance for the specialty care clinic that's separate from coming into the front of the hospital. Other hospitals, such as in Lincoln and in Monticello, built new hospitals in the last 10 years. So they were able to plan for one entrance for inpatient care and emergency care and another entrance for specialty care. So the patients didn't have to walk to the hospital. So what we're now able to do, now that we have purchased properties to the west of the hospital, is we are going to raise the houses that are on that property, create a parking lot, and a separate entrance for specialty clinic patients and providers on the west side. That's going to be very convenient, and it's going to be much better infection control, safer for patients.
Yeah, for sure. It's necessary. I'm not going to deny that. I'm curious, though. You talked about Monticello, Lincoln building new hospitals. I know a new facility is in the back of your mind. What the timeline is on that, I'm sure, is TBD for many reasons. But how do you approach that project, make it happen without spending too much money, again, with that idea of a new hospital in the back of your mind? Does that make sense?
Yes, it does. And I'm thinking less and less about a brand new big hospital.
Okay.
And this is a great example of what we're talking about, of how we're trying to think of ways to build a bigger hospital without bigger walls, hospital without walls. So one technology that really got accelerated during COVID was telehealth and talking to patients over the phone. They wanted to come back. Most of them wanted to come back. And so telehealth is still used for those patients that find it more convenient or can't get out of their house. But it did extend the thought process in my mind of eventually caregivers going to people's homes, as they do now with those larger hospitals that have home health agencies. We're going to have to start thinking about using technology and less expensive personnel, meaning those that are trained in home care rather than RNs and so forth, to go to the patient's home in the future.
So that's a new wrinkle coming to healthcare then.
Exactly. I'm looking at the next 5 years of those kind of applications that won't require knocking down a big hospital, and how to use that existing infrastructure more intelligently.
Well, and I know that you had talked about it, and when you said this, I don't remember, but you had talked about while you wanted to think about, I don't want to say plan for, but while you think about a facility, a new facility, perhaps you have to keep in mind the innovations that come through healthcare, and telehealth, in the last couple of years has been a big one. But now you're talking about, healthcare individuals and professionals going into homes. And so that perhaps lessens the need for a new facility. Is that what you're saying, basically?
That is what I'm saying. And the long range goal is not to just retain the patients in the community, but to increase market share and attract more of the patients that now still have to go out of town for healthcare. And I'm trying to project out many years and look at any kind of application of technology that I can to increase our market share. Is
a new facility of some sort completely off the table with the direction of healthcare and in-home care? Is it off the table completely, or is because of this new direction, it's just not as front and center in your mind? Does that make sense?
It does make sense. It's not off the table completely. On May 24th in Springfield, I'll be speaking on hospitals without walls. I'm working with an architectural firm, and I'll be working with their experts and having them present on ways that they see hospitals being built more efficiently in the future. I want to learn from that, bring those applications to Clinton.
Sure. Very good. Well, we look forward to more of that. Paul, let's take a time out. Come back with some more. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agents in Clinton. More to come on the morning show.
It's getting expensive to drive out of town to find what you need. This is Connie from Love It Once More Thrift Store in Clinton, suggesting that you look here first. From household items to decor, books, electronics, and clothes, we have a little bit of everything. So look here first and save. Check us out on Facebook or doitdailynews.com.
This is Ryan Utterback with Utterback Real Estate. It's that time of year again.
Oh, that's right. I forgot to change my clocks.
No, I mean it's time to spring forward and list your home.
No wonder I've been late all week.
And that's why you're the other Ryan.
Click the Utterback Real Estate icon at doitdailynews.com.
Using the latest technology for positive patient outcomes. That's the goal when you're treated in the ER at the Warner Hospital and Health Services in Clinton. CEO Paul Skowron here to let you know we've invested in an upgraded CT machine adjacent to our ER. It enables our ER doctors to detect and diagnose what's wrong with a patient clearer and faster than ever. Bigger hospitals have it, and Warner Hospitals got it. Just another way Warner Hospital and Health Services in Clinton using the latest technology for positive patient outcomes. And there's more to come.
Attention Republicans, stand by for important election information. Oh, Democrats can listen too, I guess. But they probably won't, because if you're still a Democrat, you're clearly not paying attention. Anyway, in the Republican primary for Congress, President Trump has endorsed conservative Mary Miller. Repeat, Mary Miller is the official Trump choice for Congress. We like repeating it to annoy any Democrats who are still listening. Well, the point is, Mary Miller backs term limits. She's strong on election integrity. And Mary Miller will stand up to AOC and the green energy socialists that are just killing us at the gas pump. Conservative Mary Miller for Congress, the Trump Republican choice. And in case Joe Biden hears this, we now repeat our message in a way he can understand. Trump. Endorsed Mary Miller. Paid for by Club for Growth Action, clubforgrowthaction.org, and not authorized by any candidate or candidates committee. Club for Growth Action is responsible for the content of this advertising.
This is The Morning Show on 92.3 FM in DeWitt County, WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. And again, in studio with me this morning is Paul Skowron, CEO of Warner Hospital and Health Services, as Paul talks fiscal year 23 budget that is going to be approved by the Clinton City Council this coming Monday night. The morning show, by the way, streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Paul, we were catching up as we came out of break there about a potential new facility you're planning for. This would be just kind of a small thing to promote kind of health and wellness and those sorts of things. Talk a little bit about this with us. What's going on there?
So another capital project that was approved is a building called the Wellness Center. We have empty space between our existing maintenance building and some of the houses on South Avenue. And we've asked the architects to draw up a building called the Wellness Center. You can call it a community center. Many of the critical access hospitals have one, and we're using it to promote our wellness program, which is an adjunct to preventative health care within our primary care site. We belong to an accountable care organization in Illinois that promotes wellness visits, not just for Medicare patients. That's what's hot right now, because we get reimbursed for and promoting annual Medicare wellness visits, but it's also to promote amongst all ages a wellness mentality of diet and exercise, so that people don't have to come to the hospital for the chronic problems.
Right.
We've had a wellness program for 2 years now, but we have to ask patients to come into the family medicine building and sit in smaller conference rooms. So with a wellness center, we can do many things. We can I can bring in speakers in a larger conference room, and other hospitals to come in and share in conversations like that, Hospitals Without Walls, and other clinical subjects. We can invite speakers in and have training for employees. We can have board meetings there, and there'll be more opportunity for the public to join in on any board meetings we have. But especially the wellness concept, some of these ideas about folks that are interested in learning how to cook properly. We have diabetic programs that we'd like to have a larger space to have people sit in and learn more about how to reduce diabetes. There's a whole bunch of chronic health conditions that we would like to have a bigger space to get more of the public to come in and get educated on preventative health care.
Yeah, and I was thinking about that as you're talking. COVID kind of put the preventative health care discussion to the side for obvious reasons for the time being. But before COVID, I remember that talking with you that was really kind of a growing component to 2022 or 21st century, I guess.
That's right.
Healthcare.
That's right.
So this kind of embraces that a little bit, it sounds like.
It does entirely.
And that's to that point. These are investments you've made, through COVID, even during COVID. I believe you brought on what is Mackenzie's title? You hired her to work with the community.
She's a trained wellness coordinator.
Yeah.
She's gone through education classes.
Yeah. You've made that investment. Do you mind speaking to that a little bit?
She's one of the main reasons her success. It really was a pilot program, and her energy and Mackenzie's success with developing a patient base and getting the word out there that you should associate preventative health care and wellness with Warner Hospital. It's one of the reasons that it developed the energy to bring this idea to the board and convince the board that this is something that is necessary to move on into the future.
So what will that look like? A preventative healthcare model in the wellness center. Will it be community groups meeting, classes, exercises like yoga or something? Like, what does that look like, I guess?
Exactly. It'll look like all those things. We've segregated into two separate areas, one more classroom and one more for actual exercise. There's so many variety of things that the wellness committee is getting excited about. I mean, There's self-defense. There might be senior dancing classes. We need space for all these things where people can move around and do it in a healthy way, not be too close to each other.
Yeah, sure. Very good. So look forward to those things. What's the timeline on these changes and implementing some of this stuff?
Yeah, the only thing about we've got so many things that we want to get done this year. We didn't even get a chance to talk about the emergency room expansion within the existing space. That is a very big priority right now. And before we're looking at it as a way to better use the space within the emergency room, but perhaps within 5 to 7 years, move it upstairs to where the specialty clinic is now. That's the multi-purpose reason for creating a parking lot on the west side. And so with the emergency room expanding, and then the entrance for the west side on the specialty clinic and the wellness center. And then there's also a brand new roof for $700,000 that's 30 years old. How can we coordinate all these projects within the same fiscal year? It's going to be difficult. So some of them we're hoping to get done before winter. The emergency room can work inside the hospital during the winter, but then so it'll be spring before we get, all of these done. It'll be tight to get all of these projects done by April 30th of next year.
Yeah, real quick, about 30 seconds. Can you highlight some of those capital improvements you have to make this year? You mentioned roof, emergency room, wellness center. Is there more to it than that?
There's always other maintenance, upgrades to the HVAC chiller systems and things like that. These are things that have been planned for, and we're trying to make sure we do these things now in a timely way so that we don't run into the day when it's 95 degrees and our air conditioning breaks down. So we're trying to get ahead of all the regular maintenance.
Sure. Very good. Well, Paul, always good to talk to you. Thanks for talking with us today.
Thank you, Seth.
Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Network news on the way.